welcome back, and it's a particular pleasure for me to introduce our first keynote speaker, who's Professor Aidan Halligan. Aidan was the year ahead of me in college, and we knocked around a fair bit, particularly after anatomy spots, and if I remember correctly. I think it's fair to say we've been friends ever since, and so it's nice to welcome him here. Professor Halligan is now currently Director of Well North, a Public Health England initiative to improve the health of the underprivileged across the north of England. He's Principal of the NHS Staff College for Leadership Development, and he's Chairman of Pathway, a charity for the homeless. Going back a bit further, Aidan became Professor of Fetal and Maternal Medicine in Leicester, and we kind of reconnected shortly after he took up the job of NHS Director of Clinical Governance. And I must say, he extended an invitation to me to come over that time, and we spent a couple of days together. So I witnessed his work at first hand, and at a time probably when clinical governance really hadn't become mainstream. I think that's probably fair. But Aidan was on a mission to wake us all up to the aspects of clinical governance, and in particular the aspects of it that affect patient safety. And I don't think it's any exaggeration to say that Aidan has contributed enormously to improving patient safety, not just in the UK, but I would say well beyond the UK and globally at this stage. He's an absolutely fantastic speaker, and I'm really looking forward to hearing what he has to say about rediscovering lost values. Delighted, Aidan. Thank you.
Nice to see you all. So no pressure there. Thanks, Marsh. Anyway, it's my great privilege to be here. I failed my finals. That doesn't matter much, but I failed my finals, and I was speaking to is Oliver. There you are. Yeah, we just met at tea, and how long have you been a GP?
72.
A long time. So, and he enjoys it still. He had no idea who I was, which is always really helpful from my perspective. And we just shared about failing finals, and he didn't actually. Oliver didn't. He failed first year, wasn't it?
First year, yeah.
And he had to repeat it, and then went. I'm telling him about it. Oliver here, obviously, and, much more interesting than me, and worked in a building site, and swore he'd never failed another exam because of that experience. But I worked in all sorts of things. I worked as a forklift driver in Benson Hedges, which is ironic, a cigarette factory, putting me through med school, and I spent a year in a seminary, which makes me a bit preachy at times, but I got over that as well. But I worked before I did medicine, and my communication skills I learned really as a barman in a place in Dublin, a student club. I could break up. I often say to med students, I love med students. Medical students are like pure gold, aren't they? They rejuvenate you, but I often say to them that I learned how to stop a fight with a 10p piece at 11 o'clock at night. And the only question you get at the end from 340 medical students would be, how do you stop the fight with a 10p piece? And it was a great skill to have, well, particularly on labour wards, and we'd have all sorts of high emotions there. And they used to send for me really to break up fights and look after patients and things. But anyway, life is. They say that comedy is tragedy remembered. And at the time, failing my finals was not a great thing to have done. I had a big bank loan. That didn't go down too well with my mother, but it was great. It builds your character, and I often say to medical students who are coming through, I get a chance to. We've put on particular pre-medical classes for young people who want to think about doing medicine, because so many of us go into it on the point system, and compassion is such a critical part of it, isn't it? And I often say to them that I wish them lots of failure. I have 3 daughters. I've said to them all the way through they've done fine, but I've always said that I wish them lots of failure because you actually learn from it. What doesn't kill you makes you stronger. So yeah, I did obstetrics. and I was sent to England for a finishing year, really, from the Rotunda, and got an offer to come back to work in the Coombe as assistant master. But because I committed for a year in England, I said I'd see my contract out. And then I kept getting promoted, and I was over-promoted. Having failed my finals, I was the youngest professor in field of internal medicine in England, and then took every rank, really, all the way up to Deputy Chief Medical Officer for the entire country, which was ironic given I was Irish and working directly with the Cabinet and the Prime Minister and all of that. The great thing about being Irish in England at that stage was they couldn't pigeonhole you. They didn't know which social class you came from. I didn't go to public school. I went to an extant Holy Ghost Father school, but they didn't know that, and it was fine. So I have learned that everything pivots on relationships. They used to say about me in the Department of Health that I was a hard man to ignore, but it was well worth the effort. And let me commend that to you today. But you know, so often these conferences, they're a waste of time, really. It's sad, isn't it? I mean, they're very nice for networking, and people come and smile and backclap and shake hands, and then go and do what they always did before. And the complexity of human beings is that you just don't know what's in front of you. I've learned that. My purview was 1.5 million staff. I mean, that sounds very grand, but when anything went wrong in that group, particularly among medics, I'd be front and center on Today or the media. And they hang you out to dry in a way that's most extraordinary. And our profession is the most inspirational group of people I've ever had the privilege to be a part of. But some of us forget what we should do for our patients. And it's very difficult to deal with that because they're often very charming people who have a wonderful way with them and are excellent leaders, but take the wrong route. And if the profession doesn't deal with our own, then no one's going to deal with it, and patients often suffer. So these conferences are great. I do remember speaking to I've got to the point now where I see anyone working in the health service as a healthcare professional. I've done the annual keynote for the 760 directors of finance in the UK. These are very powerful people. If any of you have any doubt that they have more impact than any consultant in this room, think again. Powerful, powerful people. They can cut you off the legs without a second thought. But some of them are remarkably compassionate and very able. Good care, badly delivered, is always diminished. So I always say to them at the beginning of the keynote, how many of you are healthcare professionals? And one hand might go up, And I just say, well, you have more power than the clinical director in surgery, anesthesia. And in a quiet way, they're very proud to hear that because they know they're part of a team that delivers that particular service. Anyway, I was trying to negotiate something recently. A lot of my life is dealt with in negotiation. I was chatting to a director of finance. It was a difficult moment, and we spoke about a conference that he'd been at the previous week. And I said, well, these conferences, three-hour conference in the morning. I said, so what did you get from it? He said, I'll tell you, he said. I have never been more touched than a 3-minute episode during it, when it was Macmillan Cancer Conference, where they were giving out awards and all the usual talks were being given about graphs and pie charts and all the rest. And this father stood up to receive the award for his teenage son who had died. He couldn't receive the award. He'd been a very brave young lad, 16, and died. And his courage had inspired so many people. So he was asked to come for the award, but died just short of the award night. His father came up to receive it, stood at the rostrum, fine, elegant man, proud of his son, distinguished, articulate, and started describing what had happened to his son. And unfortunately, there was a series of mistakes that had come together, and the boy had died because of that. And as he articulated the mistakes, he started to sob. He just cried, holding the side of the lectern. Not pathetically, but in a way that any one of us would express our deep felt grief over someone as close to us as our son, our daughter, in a very public place. And he said, the director of finance said, it was the first time in his professional life that he ever understood the criticality of his role. He felt the health service had let that man's son down. And he understood, he said, for the first time what duty meant. Extraordinary, actually, very powerful. I used that story on a group of directors of finance the next day, and for some reason it seemed to impact on them. I come across people all the time in the health service who inspire me, but you know, it's extraordinary. Most people sitting here think that that's it, you know, you're never going to change your behaviours. We are the way we are. You could be talked about by people like me for the rest of your life. You just go out and do what you've always done, because the comfort in that is extraordinary. But I work with hospitals and healthcare systems that are failing, seriously failing. And unless people change their behaviours, a community is going to lose their service, and worse than that. So people have to change. So behaviour change is the thing that most fascinates me. I often say to medical students, the most important thing for us to teach you in med school is how to think. Because half of what we teach you will be irrelevant within 2 years. And the problem with us professors is we don't know which half. I was listening to a Radio 4 today on a Saturday morning about 3 weeks ago. 8. I hate today because it brings back all sorts of odd memories for me. They're very inquisitorial and aggressive and all that kind of. You've got to be very sharp. And 8, on comes this female reporter, and she's speaking to this 95-year-old man who's in the finals of the 100 metres for his age group. And the reporter is very keen, you know, and she says, tremendous honour here, you know, in the finals of this. And do you mind me asking, what time do you think you'll do? And this man, very particular, 95, he starts to giggle a bit. He says, well, he says, the thing is, he says, I've only taken up running in the past fortnight. He said, I avoided sport, really, as a young man. He said, I was the wicket keeper and this and did that and so on. I just avoided. But when I was 87, he said, I felt my body wasn't the right shape. So I thought I'd get a coach. And by 89, I was really well sculpted. He said, it was true. I'm really pleased. And since then, he said, every year I've taken up something completely new that I hadn't done before. So I decided just recently I'd take up running. He said, and in a very sort of British and elegant way, he said, I had an upper respiratory tract infection 10 days ago, which meant I couldn't really train, apart from the past 5 days. But he said, and there's not too much competition. But he said, the thing is, I really believe you can change your life at whatever age you're at. I was listening to him, transfixed, you know, 10 past, I didn't want to hear this. 10 past 8 in the morning. And the reporter was beginning to lose it, you know, because she wasn't as much in control. He said, as a matter of fact, he said, I've written a book on this. And I'd like to get it published, and I can't find a publisher. And she sort of cut him off with that, you know. But I believe what he said, you know. I mean, the figures have come out yesterday saying that we've never had more people over the age of 100 than we have now in the UK. Fantastic. You know, I mean, the wisdom of people when they get to that stage. There was a survey of 50 95-year-olds done in North America about a year ago, and they concluded 3 things. The first thing was, you know, at 95, there's no sense in not telling the truth, is there? What's the point? So they said the first thing was they like to think about things more. They like to have more baths than showers in their lives. It's sensible. Second thing was they like to take more risk. I mean, that's absolutely true. We think it even here today. And the third thing was they wished they'd been some part of something bigger than themselves that had made a difference to the society. You know, all of you are part of that. And the question is, for all of us, do we actually make the difference that we'd like to think we made when we come towards the end of our lives and our careers? And the privilege we have, the trust we have, 92%. The population trusts us, 92%. Politicians below estate agents at 13%. I mean, you couldn't make it up. It's incredible. And yet, the population trusts us in ways that would make you so humble. I guess for me, the work I'm doing at the moment, which is I'm leading on an initiative sponsored by the government, or commissioned by the government is the phrase, to improve the health of the poorest classes across the north of England. The north of England means 10 cities. And the underprivileged in the north of England the premature mortality rates are 14 years behind the south. If you're a young girl born in Manchester today, you'll have 15 years less good health than a young girl born in Richmond outside London. And it's a disgrace, it's awful. And that's despite the fact we've put in 110 trillion. It isn't about money. It truly is not about money. It's not about freshly minted GPs coming in, army trucks either. It isn't. It's about communities believing in themselves. And I think my wife's a GP, and I think the thing about primary care is that it brings resilience to a community. There isn't a retirement age. These people are part of the fabric of that society. But when we stopped out of hours cover in England, something odd happened. People couldn't begin to describe it. The job description went off the pace. All this HR stuff is nonsense at times, because it's all about people and relationships. I guess what I have found extraordinary in all the years I've worked and at every level in the UK is that I've never seen a strategy work. I've never seen a strategy work. And I wrote lots of them. I was director of clinical for 7 years. Muiris was very kind, saying it made a big difference, but I don't think it did. Not really. I mean, it made a big difference in terms of desktop publishing, but not much beyond that. But what I was called in to do was to deal with every national disaster in the NHS for about 10 years. So I would be sent in when a place would implode. You've heard of Dr. Shipman? You've heard of Mid Staffordshire, Bristol. I could go on, I did them all. I used to, the Secretary of State would command and I would go. And I would always walk around first just to see if that place was different to some of the best teaching hospitals in London. And they weren't. That's the extraordinary thing, you know. The 5 words that frighten me are, it could not happen here. I can tell you that with absolute conviction. It could not happen here. Famous last words, like a Friday afternoon and a Sunday night in clinical terms. They are the most dangerous times for patient care. It could not happen here. I was sponsor for the national regulatory bodies. You had HICWA here, I think. We had about 4 of them in England. I was sponsor for 3 of them, which meant I was responsible for when they went into imploding areas. and all you really do most of the time is manage you'd have to manage the media, but you'd also walk into rooms full of doctors and nurses who were brought together in the grand hall, and I'd be rolled in front of them, and I was meant to give them a tongue lashing. I could never do that. It's not that I'm not a hard man, it's just that I looked at them and I saw myself. I saw people caught up in a system that had let them down. I saw poor leadership. There was one thing that emerged from all of that for me was poor leadership. And for that reason, I started a staff college with the military in England, which is heresy for an Irishman, but there you go. They know how to teach it, as do the Irish Army. We work with them. And the essence of leadership, if you do an inspection of any hospital, or any area, or any practice, it's simple. You don't need to look at the clipboard. You don't need to look at the data. There's information pathology is what I call it. It's just over the top. And people massage it all the time, not criminally, but for all sorts of reasons. So what I do is I find a HCA, that it's a healthcare assistant. They make me a cup of coffee or tea, and I lose my minders. I go into a side room and I ask, who's in charge? Nicely, not like who's in charge, as in who's the boss here? And they sing like canaries. And I know within moments if that's a safe or an unsafe ward or hospital. It's extraordinary, you can almost taste it. The eye contact you get the moment you walk into a hospital, absolutely critical. There was a Secretary of State, Alan Milburn was his name, and he said he was ferociously charismatic and wonderfully rhetorical, but he would stand up in front of the board and say, I can tell within 5 seconds the culture of any hospital that I go into. And someone at the temerity said, well, how do you do that, Secretary of State? He said, from the amount of eye contact we get. So the next hospital he went to, they were all staring at him. So the big question, though, on every inquiry that I saw over the years, the big question, I've seen them, seen every single one that you've read about for the past 10 years, You know, the buttock clenching nervousness sitting in front of a very senior politician who then has to face the press and says, how can you people let this happen? Didn't someone know? Didn't someone know? And you see, we did. So the big question that I got left with after all those years was, why didn't the doctors speak up? Well, you know the answer. But in so many ways, there were three major reasons. One was the normalization of deviance, which means, I often do with medical students, I say, look, the two of you are friends now. In 15 years' time, you'll be godparents to each other's children. And one day you'll be in a ward round and you might be insulting to a patient and you'll be with them. So what do? Do you challenge him? And then go to dinner in his home on Saturday night? Well, you don't, actually. A lot of people wouldn't, because they'd lose a friendship. That's what happens. This is what happened in Mid-Staffordshire. A lot of those consultants came from a particular part of the south of England and migrated up towards that area, and their behaviours became tribal in a particular way. But you normalise deviance, and after a while you don't notice that it's happening. The second thing is, Lord Acton said power corrupts. Absolute power corrupts, absolutely, but nothing corrupts like loyalty and friendship. And the third thing is, what you permit, you promote. So every one of you have seen things that shouldn't have happened. And your big brains has justified it in all sorts of ways, but the patient didn't have a choice on that day to be sick. And vocation isn't about religion. It just isn't. It's an unsentimental commitment to do good within a professional context. Now, the big problem for us is that we're overly defensive about enhancing our reputations at times. And reputations are destroyed in all of this at times. And beyond that, we're obsessive about institutional political correctness. Telling the truth to power is something you should be taught from the moment you go into med school. Because the patients expect that you will speak up on their behalves if no one else will. It's extraordinary. I never got that lecture in med school. I'm giving it now, several med schools. I give it in second med. And the medical students really get it. It's extraordinary. But what we then do is go on to develop their leadership capability. And leadership capability is about communicating moral energy to individuals who need it. So when you're scared, and if any of you haven't been, you're not doing enough work. When you're scared, and you're the boss in particular, everyone looks at you. They watch everything you do. Believe me, you're not listening to what I'm saying. You're watching the way I move. You're watching my visual dress sense and all that kind of stuff. I've got used to this over the years. I've got counselling for it and I'm taking tablets. But believe you me, even among yourselves today, you're watching everything you're doing with each other. So I get the train each morning, standard class from Loughborough down to London. It's an hour and a half. I love humanities. Human beings I can't really stick at times, and particularly at 10 to 6 in the morning. So I'm on the train. I come to a four-seater, and there's generally a bloke sitting on the far side and a table between us. A funny thing happens. A laser comes from the roof and divides the table into 4 equal parts. The most extraordinary thing. And if his newspaper or iPad crosses that line by 1 millimeter, I'm starting to dislike him. I've never met the guy. We've never exchanged a word. And by the time we get to London, I hate the bugger. I really do. And then it dissipates. But you know, the truth is, we notice everything. With medical students, I often talk to them about observing patients. Take them to a train carriage. It's perfect. It's like Coronation Street on wheels. You just need to see and listen with your heart and your mind. Patients, the last question they asked is as they reach the door. That sort of thing. I remember that was always the way. Say you had a friend who, etc., etc. Anyway, people notice absolutely everything. I guess it's always the particular that has persuaded me in many ways. It was Martin Luther King Jr. who said, "Our lives begin to end the day we become silent about things that matter." Our lives begin to end the day we become silent about things that matter. How many red lights have we all gone past? I've gone past lots of them. I've gone past lots of them. By God, I'll tell you, you try to give bad news to a Prime Minister. It isn't him who gets upset, it's the two blokes behind him, you know. And that's the way it works. I've done that 3 times in my life, not once to a Prime Minister. Bad news, really bad news. I got promoted instantly on the first 2, and the third one was almost lynched. But you have to have the same equanimity of mind on all 3. You have to be prepared to take the consequences of telling the truth. And that takes, I'll tell you, that takes real courage. It is extraordinary. Medical students, I follow them a lot, and in UCL we've got a wonderful bunch of young people, all extremely articulate, often public school. And one chap in particular was an amazingly able young man. He was president of the leadership group that they put in place. We put him through staff college with the military, he did fine. Anyway, I saw Lyndon about 3 weeks after he started in August, about 2 years ago. He was walking along the corridor, and he normally had a bounce about 1 metre high when he'd go past you. This time it was about 1/2 metre, so he was clearly a bit down. So I figured he must have been on a night call or something. He says, "Lyndon, how are things?" And he said, "Yeah, they're fine." Yeah. I said, "Cup of coffee." So I brought him for a cup of coffee. The second cup of coffee, being a bloke, they never talk about stuff. And I said, "So what's the problem? Do you not like the patients?" He said, "No, I love the patients." It does happen. I love the patients. They're fantastic. "What's the problem?" He says, "Well, the thing is," he says, "I'm working in a colorectal firm, and there's 66 different specialisms, so don't take this personally if you're in that specialist." But he said, they're just dissing the management all the time. Everything that's suggested by management, they go along with, but behind closed doors, they say it's a load of rubbish. Even the WHO checklist, which is, beyond evidential bomb-proofing. Because they know better, he said. But it came to a head yesterday morning. He said, I was doing a ward round on the ward, consultant leading through, colorectal surgeon with 6 people behind, junior doctor, the usual, and came to a woman in a room who had been operated on the day before. She was sitting quite stiffly under her sheets, and he said, consultant came to her and looked in the trolley, couldn't see her notes, and said, I'm sorry, I haven't got your notes, we will come back later. And she, clearly a brave elderly woman, just been operated on, said, "Doctor, I'd really like to talk to you." Yeah, can you imagine? I mean, you've been patients, I'm terrified when I go near doctors. And you just completely become childlike. And this woman's lying there, having been operated on, not knowing the outcome. And she said, "Doctor, I'd really like to speak to you." So he just turned his back slightly to her and kept looking in the trolley. Busy guys, good surgeon, nice man. But this is what happened, and said nothing. And she again said 20 seconds later, "Doctor, I'd really like to talk to you." He continued to keep his back to her. And 20 seconds later, she said the same thing, and he continued to keep his back to her. Now Lyndon, who's a very thrusting, able, bright, brave, tremendously able individual, said a funny thing happened. A force field descended to everyone on that ward round, who knew that all they had to do was reach out to that woman. It's pretty simple, isn't it, really? You just smile. You put a hand on her hand, and you say, "I'll be back to you." It's really straightforward. It's what really good nurses do all the time. That's where I learned most of it. But they couldn't do it. They couldn't do it because of all the things that goes into challenging the authority of the consultant in that moment, and particularly when you're junior. And of course, what you permit, you promote, and normalization of deviance, and that's how it all kicks in. And he was just so depressed about it. Now, the thing I often think about is how would he perform 2 hours later in the A&E, which is where he went? Do you think he'd be a safer, more experienced, more able doctor because of that experience? And how could you tell by any form of assessment? I have 3 daughters, and they say, Dad, never tell a joke, because I always get the punchline wrong. But I'll tell a story, and the stories are true. I couldn't tell them if they weren't. I remember when I was Deputy Chief Medical Officer hearing about this story, which I checked out myself. A London hospital teaching ward round. Professor going around with 12 people on. Professorate ward rounds are, as you know, things to be enjoyed. And it was an elderly care ward, and came to this 84-year-old man who was slightly confused. I'm sure he had dementia. Unfortunately, the young doctor, the intern, was also confused and gave an appalling history. The professor turned to the group and said, I'm fed up dealing with these stupid patients. That actually happened. It happens, these things happen all the time, but we dismiss them. Anyway, the reason we shine our shoes in the NHS is that the standard operating procedure in that moment is to look at your shiny shoes. Because if you look anywhere else, you're in trouble. What's your name? Wahid. Aidan Halligan. If anything goes wrong here, Wahid. Because if I catch Wahid's eyes, we've connected in a way you don't normally connect. And we have a relationship between two people who've never met before. That happens on ward rounds all the time. Anyway, everyone looked at their shiny shoes, as you will mentally as I tell you this story. And the consultant, the professor, walked off in high dudgeon. The youngest member of that ward round was who'd been an estate agent and then decided at 26 she'd do something worthwhile with her life. And she sees this behaviour. So she's not much to lose really in all sorts of ways, allegedly, but it's all relative. But she catches the professor at the door as he's going out. He says, Professor, no one speaks to a patient like that in my ward. Now, do you think she was brave? Do you think she had a job 6 months later? Hands up.
Yes.
Great, you should punch, yeah, she had. But my stories don't have happy endings, you gotta watch that, you know. She became the youngest sister on that ward, but she left nursing 18 months later. Who do you think criticised her most? No. Or peer, exactly. The doctors like a good Barney, you know. I mean, most of the time. No, it wasn't the doctors, it was the nursing staff. And that's counterintuitive. But oddly, once you break the tribal taboo, that's what can happen. Professor wasn't a bad man. He turned to her at the door and he said, I'm really sorry, I've had a row with the kids over breakfast. He said, let's just go and apologise to the patient together. Now, I'll tell you, this is absolutely true. That story got around the entire hospital within 15 minutes. The entire region within 4 hours. And the next morning, someone burst into my really fancy office and went on and said, you won't believe what happened. And no one sent an email. Absolutely extraordinary. The power of gossip. Every one of us. People normally get paranoid when I tell that story because actually people notice everything. As I say, they notice it all the time. Education of the mind without education of the heart is no education at all. Socrates said that 1,000 years ago. And yet, for so many of us, we count our achievements in terms of academic qualification. I've failed my finals. I know exactly what sort of mind I've got. I've got 5 professorships now, every degree you can possibly imagine. I gave back my fellowship to the Royal College of Physicians because I asked them, what would it take for me not to be a member in good standing? They said the only thing that would make that happen was if I didn't pay my subscription. I just thought, what's the point? They've actually had a change of heart recently, but it is fascinating to see how we see ourselves in the middle of all of this. Education of the mind without education of the heart is no education. We are not scientists. We're meant to be compassionate. I was taught a very good lesson about compassion from a healthcare assistant who was a receptionist in. That's a lovely ringtone. No, that's very relaxing. I used to do lots of inspections, and I'm going around this hospital in the Midlands, and I would always be given minders, senior doctor, senior nurse, and you'd wander along. It was like the Queen, you know, she always smelled fresh paint, so things were perfect. The 4-hour wait was 99.9%, and there was no problem at all. And all I ever did after, I was around every hospital in the NHS twice in my career. I used to just do the people thing a lot. And I spot patterns of behaviour and spot people. And as I was going around, this HCA receptionist behind the desk in the A&E was studiously ignoring me. Now, I'm very sensitive to that sort of stuff, but I thrive on rejection, so so I said to the senior doctor, who is that? And the senior doctor said, well, unscriptedly, so that's Dolly, as if I should know, because they all knew who Dolly was. I was just in there, you know. So tell me something about Dolly, and he says, and this is the truth, he said, the first thing he said was, there's been no complaint against Dolly in 27 years. So I can see a league table of complaints against everyone in the entire place in my mind's eye. The nurse says to me, when I asked, she said, well, the nurses in these places are like regimental sergeant majors, you know, they give you the look. You know the look. So she gave me the look and she said, if you don't get on with Dolly here, no matter what your grade upper consultant, you don't get on with this A&E. I said, great. So I lost my mind. I went over to Dolly and said, Dolly, it's nice to meet you. And she gave me the look, you know, and I said, you're more influence here than the chief executive. And she said, oh, I wouldn't say that. Very politically astute, you know. And I said, tell me, I said, what's the secret? She said, do you really want to know? Because people like me are normally promoted because we're bad at the day job. I used to say that to thousands of staff, and they used to laugh at Rory because that's exactly what they thought. I said, what? You know, what's the secret? She said, well, it's down to one word. I said, fantastic. I couldn't believe it. I was going to learn something extra. I said, what's the word? And she said, kindness. And I thought, oh, you know, let's go hug a tree and drop our process. You know, who does kindness in hospitals? You know, I was just thinking, and I said, well, what do you mean kindness? What do you mean exactly? And she said, well, she said, the least sick in A&E are often the most anxious. So I bring them a cup of tea without being asked. And she said, before you say a word, it's not a cappuccino with a twist. The PID was 3.5 pence. The polystyrene cup is just hot with milk. And she said, when you have a bad day, she did the finger thing, she said, when you have a bad day, people suffer. I said, well, I can't comment on that. And she said, when doctors and nurses hear of bad days, patients suffer. So what I do is I bring them a cup of tea without being asked. We check, I used to have roving teams who do quick surveys and this sort of. We found that if you were a member of staff, a doctor or nurse in that A&E, and you saw Dolly approaching you with a cup of tea, you knew you were in trouble. And your behaviour changed. Now I'm going to tell you something that I have learned that is the most powerful piece of knowledge in my professional life. I understand why the lowliest individual in that A&E, Dolly, had the biggest impact on that entire staff, professors, and she did, believe me that. She got her authority from how much she cared. And you can't fake it. You cannot fake it. People know exactly what sort of doctors and nurses and managers you are. They know exactly. They'll be respectful to your face, but they know exactly. And they've heard stories that will come back to them again and again and again. Stuff you've even forgotten you've done. You get your authority from what you get. Guess who does that? The military. The military do not work off hierarchy. They work off looking after their men and women like they are their mothers and fathers. And they grieve for them when they're killed, like they are their mothers and fathers. Except they harden their hearts in those moments. It's the most extraordinary thing. You get your authority from how much you care. If you want to stand in front of your ministers, or your prime minister, or anyone, and want to negotiate something, if you really care about your patients as opposed to yourself, you'll get whatever you need. Absolutely. Money back if you don't. In the military, there's been Captain Noel Javas got a double Victoria Cross in the First World War and an MC. He's a doctor, never fighted in anger. But he was given the Victoria Cross, which, if you probably know, is the highest award in the British Army. You have to have a 95% chance of being killed to get it. It's a bad career move. He got it twice and then was killed. He was the son of the Bishop of Liverpool. I was fascinated by him. He was a small-minded man at times. He could be petty and malignant and pull strings, as we all are. But in the moment, he gave his life for people who needed medical care. Extraordinary. Absolutely amazing. Compassion and courage are one and the same. What's compassion? Well, I could give you definitions, but I won't. I'll tell you another story about a hotel in Glasgow called the Intercontinental Hotel. I don't have shares in it or anything, but it's a true story. of a man and his teenage son who were having dinner there one night. At the end of dinner, man goes up to the maitre d' and says, "That was a wonderful meal, thanks very much." He said, "I'd just like to say that we've been coming here for months. And my son has leukemia, the treatment hasn't worked, we're starting chemotherapy tomorrow. I'm going to take him to his room tonight, shave his head bald, and shave my own head bald." I mean, if you've got children, you know, there's nothing you wouldn't do. So the reason I say it is that I know the waiters on tonight are the same waiters who are on tomorrow morning. Would you mind asking them not to stay when we come down for breakfast? Because we're going to be absolutely bald. And they've seen us tonight with full heads of hair. The next morning, the two of them came down for breakfast. And 5 of the waiters had shaved their heads. That's a true story. Absolutely true story. And they got paid less than our HCAs. It's taken me a long time to understand that. Compassion always costs. That's the privilege of what we do in the health service. We don't count the gain for ourselves. I have a dream is what Martin Luther King said. A great speech, I'm sure you've listened to it. Imagine if he'd said, "I have a strategic plan." It just wouldn't quite work. What's fascinating is I was sent to Afghanistan by the government in England about 6 years ago to look at medical leadership in the field. Doctors and nurses, they seem to behave differently in uniform. They're all NHS, territorial, reserve. And I was asked to see why there was a difference. I was given a particular rank so I could ask whatever questions I needed to ask. I was completely overwhelmed by the compassion, safety, and quality of care given to Taliban, British, American. Unbelievable. I've never seen care like it. Absolutely extraordinary. So we came back and we set up an NHS staff college with Sandhurst and Shrivenham, full of commodores and captains and colonels and our own staff. And we put 1,000 doctors and nurses and managers through that over the past 4 years. It's now catching on. We're putting it in the most deprived areas. We don't have castellated settings. And I will not have anyone but leaders teaching leadership. Charles I said, "There's more to the doing than bidding it be done." Just before he got his head lopped off. Leadership is about communicating moral energy. To do that, you have to know who you are. So we put them through selection, voluntarily, and then we put them through profound deep dive self-awareness. And then we put them through profound deep dive self-management. They're transformed. Because we select very carefully. Just last week, I always debrief them. I send them a personal note afterwards to give me personal feedback to see if we hurt them or if we can do things better. The head of clinical surgery in a very big hospital in England just went through it, and I saw him. And he said, "It's been transformational, it's changed." What was he, 51? He said, "It's changed my life. I cannot believe that." He said, "But I have one objection," he said. The level of honesty in the challenges within our own teams was almost too much at times. He said, "Some of my team said to me," because we do this in a particular way, so, that they felt that I didn't listen to them. They felt I had a short fuse when I got stressed. I said, I mean, it's all true, but I never want to go through that again. So you're saying that you should, what we're doing is developing these people to be our own instructors. That's what we do. So Galway Clinic would have its own instructors on site. Having gone through that, we don't bring in management consultants. And he said, "But I don't think we should have our own instructors within our own hospital." And I said, well, why not, Tristan? And he said, "It's just too emotionally challenging." I said, "Well, we're doing that in a controlled environment. What happens when there's a real disaster? Isn't it better to find out your relationship challenges before a patient has to suffer because of it?" Well, an honest guy, he put his head in his hands and he said, "Do you know, you're right." I mean, very seldom a surgeon will ever say that to me. He said, "Do you know, you're right." And I said, "I'll tell you something else." I said, "You'll be a perfect directing staff. You'll be one of our instructors." He's volunteered to be an instructor. That kind of thing really inspires me. You know, the thing about leadership is, what is leadership? When you see a leader, you're inspired. When you're inspired, you become a little bit more determined, just for that moment. And when you're a little bit more determined, you go further. Not because of your appraisal or your job plan or your that nonsense. I mean, it's great, but it's, you know, it just doesn't impact on how people work. People said the difference between Gladstone and Disraeli was that when you left Gladstone, you thought he was the wittiest, charming, most erudite person you'd ever come across in your life. When you left Disraeli, you thought you were the wittiest, charming. The thing about leadership is that real leaders move the human heart. That's the truth. They move the human heart. Mayo Angelou said, it wasn't what you did, it wasn't what you said, it was the way you made people feel. That's all that ever counted. That's all that ever counted. And we are given the privilege in our society of having the most senior, influential portfolio, mandate. And so often, we don't deliver on that. It's my privilege to lead on improving the health of the poorest classes in the north of England. You should see these people. You should see there's no grannies above the age of 60. There's teenage funerals. We put billions in. And in many of these places, doctors aren't leading in the way they should be leading. So we're teaching the community to lead alongside doctors and policemen and bring them together in teams. Anyway, I'm going to finish up. I remember someone said to me, he said, well, that's a good talk, he says, it's fine. He said, but never forget the difference between a halo and a noose is only 2 inches. Meaning that when you think you're invulnerable, that's the moment you're most vulnerable. Those who have the ability have the responsibility to do the right thing when something goes wrong. I gave a talk in Australia a few years ago, and this guy said to me, and he said, that's a good talk, he said, but never forget, all roosters become feather dusters. We will all retire. We will all move on. We will not have the opportunity to impact in the moments we have now. The staff college motto, our staff college motto is to do the right thing, particularly on a difficult day. Thanks for listening to me. Thank you very much.